Hi, everyone, and welcome. My name is CJ Walker, and I am so glad that you're joining us for another session in our Type 1 Diabetes Screening Series, a space where we could bring together experts and community members to share, learn, and support one another. Tonight's session, talking to your healthcare clinician, how to advocate for Type 1 diabetes screening, focuses on how to start and continue important conversations with your care team. Whether you're a parent, an advocate, or someone with lived experience, knowing how to communicate your needs and ask the right questions can make all the difference. At Diabetes Sisters, our mission is to support and empower women living with all types of diabetes through education, peer connection, and shared experiences. By learning how to effectively advocate for screening, you can help better shape outcomes for yourself, your loved ones, and others in the diabetes community. Speaker introductions. We are honored to be joined tonight by an inspiring and knowledgeable group of speakers. So first, I'd like to welcome back Dr. Victoria Bouhairie. She is a triple board certified in endocrinology, lifestyle medicine, and obesity medicine. She is the founder and CEO of Perry Wellness and Diabetes Center and a board member of Diabetes Sisters. Her work centers on empowering patients through preventative care, lifestyle interventions, and education, helping them take an active role in their health. We're also joined by Dr. Ebenezer Enchia, who brings a unique and compassionate perspective to diabetes prevention and family health. Originally from Ghana, West Africa, Dr. Enchia is now proud to call Cincinnati, Ohio home. He is a board certified in family and preventative medicine with additional training in general surgery and is deeply passionate about supporting the health and well-being of individuals and families from all backgrounds. When he's not caring for patients, he enjoys spending his time with his toddlers, staying active, and grilling great food. And tonight, we're honored to have two incredible women joining us to share their lived experiences with type 1 diabetes and screening. Jamie Klein, a mother and advocate who brings an authentic, firsthand perspective on navigating the emotional and practical sides of screening. And Tia Ware, a woman living with type 1 diabetes who will share her journey and importance of self-advocacy and receiving timely and informed care. Thank you all for being here and sharing your experiences and your voices. So advocating for type 1 diabetes screening can feel intimidating, but it doesn't have to be. Tonight, we'll discuss how to start open and informative conversations with your healthcare provider, ask the right questions to ensure you or your child receive appropriate screening and follow-up, build confidence in understanding the role of antibody testing and early detection, empower yourself with tools to make shared, informed decisions about your health. You'll hear practical guidance from our experts as well as personal stories that highlight the power of advocacy and community. Together, we'll explore how communication and awareness can lead to earlier detection, reduce stress, and stronger partnerships between patients and providers. Some housekeeping rules before we begin. You're welcome to use the Q&A box throughout the first half of the presentation. Our speakers will address as many questions as possible during the second half of the event. After the main discussion, we'll move into breakout rooms for a live Q&A. This will be your chance to speak directly with our speakers, ask questions, and connect with others in a smaller and a more personal setting. So now we are honored to begin tonight's discussion with Dr. Victoria Bouhairie, who will share expert insight on the importance of communication, advocacy, and proactive screening in diabetes care, along with Dr. Enchia. So Dr. Bouhairie and Dr. Enchia, thank you both for being here, and the floor is both yours.
Well, thank you so much for that wonderful, very warm welcome. All right, we're going to go ahead and kick things off. So today we're going to focus on really how to advocate for screening. And I'm really excited to have Dr. Enchia here again, who's a primary care physician, because really he's part of the group of healthcare providers that will be the first that you will talk to about screening. So let's dive into what type 1 diabetes is. So this is a chronic condition, meaning it's a long-term condition. in which the beta cells, which are a particular type of cells in an organ called the pancreas that releases insulin. And insulin is very important because it helps your body to regulate blood sugar levels. Without insulin, your blood sugar levels can become extremely high, and that can lead to long-term complications such as diabetic ketoacidosis. And unfortunately, diabetic ketoacidosis, or DKA, can be life-threatening. I'm going to turn over to Dr. Enchia here as to some of the demands when it comes to type 1 diabetes.
Thanks again for the introduction. So in seeing your primary care doctor, one of the important things that we try to do are just being really preventive. So a lot of the care that happens before um, diseases and complications happen. So it's really important. One aspect of just your care is the first step is screening. And the whole point of the screening process is it's in two parts. One, providing you with a knowledge of um, what is needed to watch out for, to be on the lookout for, as far as it comes to many different health conditions. So in this case, type 1 diabetes is what we're focusing on. And the whole idea with this is, like Dr. Bouhairie was saying, the complications is one of the dire complications, and that we see is diabetic ketoacidosis. Um, so we're doing this evening to try to limit the risk of those complications from type 1 diabetes and other aspects of health. Um, so in focusing on that, I do like to highlight to patients, especially when patients are a little um, uh, concerned about what the implications of screenings are, and therefore lean away from screenings. I try to always give a broad overview of the next steps to empower you with knowing, okay, just because I have a screening does not and a possible a possible positive screening does not mean that's the end of the road. The slide shows that um, there are different avenues of what the next steps will be, but more importantly, that there are resources for different healthcare screenings, cancer screenings, but especially type 1 diabetes screening. So
Yeah, so
just understand the importance of that.
Yeah, so that's extremely key. And the reason why those things are key is because the demands for type 1 diabetes is extremely high. Whenever you have type 1 diabetes, there's the need for, constant monitoring with blood sugar levels. You really need a support team. So Dr. Inchia mentioned, the fact that in the clinic, there are different people there that can really help with that preventive aspect of it. And sometimes it's not all chronic disease that are preventable. However, sometimes if you can detect it earlier, then that can be very, very resourceful. With type 1 diabetes, you have to think about the meals that you eat and exercising. You have to think about the emotional aspect of it. You also have to think about the need for constant insulin use. Another thing that you have to note is that there are risk factors when it comes to type 1 diabetes. If you have both parents with type 1, that risk can increase all the way up to 30%. Father with diabetes, that can go up to 8%. If you have a mother with diabetes, that risk can increase up to 4%. And if there's no family history, of course, you have the risk is similar to the general population. Dr. Anchia, do you have anything to add to this?
Yeah, this I definitely want to comment on family history because it's one that can be easily glossed over when you're visiting with your doctor. And I do want to uh, put a spotlight on it because this is just like with type 1 diabetes over here. It's really a lens to discovering so many preventive actions that can happen with your health. And a lot of the times it does take um, some uh, effort before your visit to reach out to family members who you may not have you may not be on speaking terms with some family members, especially with regards to health. I know in certain cultures, it's talking about sensitive issues like that. It's not commonly done, but I definitely encourage my patients to try to find out um, uh, what health conditions parents had or siblings had, and what have you, so that if there's something you have that in your medical record, and your healthcare provider can connect dots just from seeing what your blood work is. So in this case, we see a strong link with type 1 diabetes and family history. So if that information can be provided during your visit and updated every year, if there's a new health condition or cancer or health condition that you discover in a close family member, to let your primary care physician know.
Yeah, excellent points there. It is very important to realize that most people actually do not have a family history, those who are diagnosed with type 1. And what studies have shown is that over 85% of people don't have that family history. So even though you have an increased risk, majority of people do not have a family history of type 1. And unfortunately, about 40% of people that are diagnosed with type 1 diabetes are diagnosed with that life-threatening condition, diabetic ketoacidosis. It's important to realize that there are actually different stages of type 1 diabetes. What we tend to know and recognize is that stage 3, what we call the clinical stage of type 1. And that's where you have your symptoms, where you have increased urination, increased thirst, as well as very high blood sugar levels. But we also know that even before those symptoms, you can have a diagnosis of type 1. Stage 1, type 1 diabetes, is when you have the presence of antibodies, at least 2 or more. However, you don't have any symptoms and your blood sugar levels are normal. In stage 2, again, no symptoms, but you have mild elevations of blood sugar levels. And then finally, as I mentioned, stage 3 is when you have the clinical signs as well as elevated blood sugar levels. It's important to realize that stage 1 can occur months to even years before stage 3. Dr. Atul, can you describe or tell us why it is important to detect type 1 diabetes early?
Yeah, so we talked about the complication that's diabetic ketoacidosis, but um, there are many other uh, me- medical, but also psychosocial factors of just discovering things early, and being prepared for what that means. So the preparation in itself, clinical study access, Dr. Bouhairie will go through some access to research and treatments that are available if we discover through early detection, and just the um, comorbidities, health conditions that can happen from undetected diabetes, cardiovascular complications, which can be prevented, is also key. And then, of course, hospitalization, which I do my best. One of the key things I try to prevent are emergency room visits and hospitalizations for any health condition.
Excellent. So what does screening involve? This is actually a blood test, and we look for antibodies. As I mentioned at the beginning, with type 1 diabetes, there are specific antibodies that are present that are the result of destruction of these beta cells. And the antibodies that are listed here, the zinc transporter 8, the glutamic acid decarbolase, the islet antigen 2, as well as the insulin autoantibodies. These are antibodies that the American Diabetes Association recommends that we test. There are different ways in which you can get these antibodies tested. It can be done through research. The ASK program as well as TrialNet are two research programs that you can get testing. There's some state-based screening programs. The Cascade and Pledge are some examples of that. Your healthcare provider can actually order a lab kit that gets sent to their office, and you can get testing done that way. And then finally, your healthcare provider can order these antibodies, and you go to your local lab, be it LabCorp, Mayo, or Quest, and you can get it done that way. So if you test positive, then it does not always mean that you have type 1 diabetes. It requires at least 2 or more autoantibodies to be present and confirmed to give you the diagnosis, regardless of whether you have one or multiple antibodies. It's very important that you have follow-up. And this includes regular metabolic health tests, which are blood sugar tests. You want to make sure that you gain knowledge as well as have a support system. For example, if you're in stage 1, you really want to make sure that you understand what type 1 diabetes is. What we do know that is that from stage 1 to stage 3, there's about a 45% risk of developing stage 3 in 5 years. And then if you're in stage 2, it's about a 75% risk. So you really want to empower yourself with knowledge. You also want to consider treatment options. There's a newly available medication, teplizumab, that came out in 2022 that has shown promise when it comes to the delay of stage 3 type 1 diabetes. You also want to be prepared for any potential emergencies. What we do know is that those that are screened and are monitored, the risk of diabetic ketoacidosis goes down from 40% all the way down to less than 5%. So monitoring is crucial. And then finally, you have the option of undergoing other research opportunities. As I mentioned, ASK program and TrialNet, all those are research-based screening programs. And if you test positive, you have the ability to enter various trials that are available. Teplizumab is the medication that I mentioned, and this is very exciting because it actually goes to the heart of the condition, to the destruction, really targets those cells that destroy the beta cells. It is FDA approved for anyone who is 8 years old or above that has been found to be in stage 2 type 1 diabetes. For more information, you can always go to DiabetesSisters.org. There are multiple resources that are there, from webinars all the way to different PDF files that talks about what we discussed today. It has downloadable resources that you can take to your primary care provider and really empower yourself, giving you the tools to be able to know how to screen and what to do with the screening results.